Hello, my name is Dr. N.Arandi, Associate Professor in Psychiatry at النجاح. Today I will present a very interesting syndrome. It is somatic symptom disorder. It is one class of other disorders as before ICD-10, ICD-4. It is related to somatoform disorder. Now in DSM-5, it can be classified as somatic symptom disorder, illness and anxiety disorder, conversion disorder, factitious disorder, and malingering. Let us talk today about the somatic syndrome disorder. The prevalence of somatic syndrome disorder is 4%. It is equal between male and female. Age, it is at age 30 or before. The characteristic feature of this syndrome is multiple somatic complaint in different organs in the body, mainly in 4 organs. It could be in cardiovascular system, digestive system, musculoskeletal system, and nervous system, and sexual system. For example, with regarding to neurological symptom, it could be multiple symptoms like headache, nausea, dizziness. It could be in musculoskeletal system, muscle pain, joint pain, neck pain, arm weakness, or arm pain. In regarding to digestive system, could be any of the disturbance in digestive system, such as wind, bloating, colic, pain, diarrhea, frequency of micturition, could be sexual symptoms. How we diagnose the somatic syndrome disorder? It should be containing one or more of somatic symptoms with preoccupation and exaggerating of the stress, and preoccupation with overthinking about the symptoms, and with exaggerated emotional response, and health behavior, which is doctor or health behavior about concerning and be calming about going to doctors, to be calm about the symptoms or the treatment of these symptoms. Should be continue for 6 months. I want to say that the symptoms should not be currently exist, all of them. It could be one or more, and it could be running for a few months and then substitute by another symptoms. The severity of the symptom disorder can be in 3 stages. Could be mild, moderate, or severe. Mild, one cognitive symptoms or physical symptoms, moderate 2 symptoms or cognitive symptoms, and 3, it is more severe and more than 2 symptoms. What I am saying, it is the symptoms, although we are discover that there is no organic causes, but can be explained what is going on. It is arising from the brain, from the psyche, and it is producing by the psyche and exaggerating by the mind, actually. Let us say about the etiology of this disorder. This disorder can be, there is multiple factorial for the etiology of somatic symptom disorder. There could be genetic factor, familial raising factor, environmental factor, and could be a cultural factor, and there would be personality traits or constitution. All of these could be in childhood. There is some trauma during childhood or adolescent. All of these factor could be accumulated and precipitating by a stress factor in his life, and could be contributed or perpetuating by many factors which maintaining the complaint. Let us going before the diagnosis about the differential diagnosis. The differential diagnosis between somatic syndrome disorder and other disorder, which like, for instance, as we know, somatic symptom disorder, it is running unconsciously, could be differentiated by illness and anxiety disorder and conversion disorder. With regarding to conversion disorder, it should be there is neurological signs, so either motor or sensory. Illness and anxiety disorder, it is raising in the mind with it is a preoccupation with the patient that he has serious mental or physical disorder or illness. As we notice, everyone in somatic symptom disorder, it is about multiple somatic complaint regarding to conversion. It is regarding to conversion the psych into medical or neurological symptom. With regarding to illness and anxiety disorder, it is going as the patient have a serious illness with no organic lesion for all of them. This is differentiated from maybe conscious disorder, or which is called before in ICD-4 as somatoform disorder. There is a factitious disorder and malingering. Factitious disorder, there is a primary gain, which is a seeking behavior to take attention of from the medical team. In regarding to malingering, there is a secondary gain which the patient try to gain it from his sickness, such as in military process or in road traffic accident. How do we manage these cases? Let us specify about somatic symptom disorder. First of all, we should do our raising a therapeutic alliance, which means that making a good relationship with the patient, which included sympathy, empathy, good listening, body language, trust relationship with the patient, understanding what he's saying, and this is accompanied by body language and suggestion. We should do a protocol for this patient, management protocol. Mention that how many visits in the month, could be 1 or 2. The duration of the visit should be for half an hour, and we do all of the investigation which is necessary for once, and make a limitation of contact with the patient. Not every day is coming to you. It is scheduled once every month or every 3 weeks, and we fixating this attachment. Whatever he coming again, if he has any new symptoms, we could do a small, short physical examination and explain for the patient. What is going on? We can do cognitive psychotherapy, stress management training, relaxation training. We can do yoga for him. It could be psychotherapy, supportive psychotherapy, pharmacological treatment, and so on. It is essential to know before for the differential diagnosis, to know if the patient has the syndrome as only or comorbidity with another syndrome. For instance, could be a comorbid with depression or an anxiety disorder or post-traumatic, for instance. This is very important for the treatment, because we can treat the comorbidity syndrome. It could be accompanied or comorbidity with physical diseases like diabetes, cancer, gastrointestinal diseases, chronic pain he has, and osteoarthritis. And this is raising additional multiple complaint, which can be mixed or unclear it is coming from, or separately, or from the medical condition. However, we try in all these therapeutic alliance. It could be for pain, we use duloxetine, as you know, Cymbalta, could we use SSRIs. As we know, the main purposes of this treatment, it should done step by step to make to the patient that there is a relationship between whenever he has physical complaint, there should be a psychological stress. If we coming in long-term treatment, he need maybe 20 session psychotherapy session for the treatment of disorder. If we, in conclusion, if we coming on the point that we correlate and make the patient understanding there is a correlation between what he is what he has feeling and what is this feeling or an anxiety which led to physical illness, and he is usually run in a vicious circle that he has physical complaint, distressing, anxious preoccupation, and emotional, exaggerated emotional, and health medicine and health behavior for be sure about his health. Thank you for your listening.